Hello everyone. So today we are going to know about cataract. What is actually a cataract? So we have a model of the eye here where we will show you what exactly is cataract. So this is your eye when you see from outside. When we put a light through the center, which is called a pupil, the light can actually reach the retina, where the yellow part, which is the retina, we can see the light reaching that part. When there is a lens in the eye which is at this side. Now when this lens is transparent, the light will actually reach the retina. But when this transparency is lost in the lens, then opacity is formed in the lens, and when we pass the light through this opacity, the light is not able to reach the retina and the optic nerve, and your vision is disturbed. So this opacity in the lens, in your lens, is called a cataract. Now cataract can be actually in any age. So it can be right from birth, and then usually it affects the later age group. From birth, these are called congenital cataracts, which are basically because of disorders either in the newborn child, which happened during the intrauterine period, that is before their birth, or if the mother was infected by certain the organisms, then also a child can develop a congenital cataract. So if in a newborn child you see anything white in the center of the eye, then immediately you need to take the child to the eye specialist. Now usually we don't expect developmental cataracts, that means which develop over a period of time, to come in the early age groups, say around 2 years, 3 years to say around 30-35 years of age group. And now lately we have started seeing these cataracts coming in 30s and 40s as well. So if you have a blurred vision, which you did not have before, you have spread of light, especially while driving at night, or you have difficulty in focusing in sunlight, then you need to immediately consult an eye specialist. Later age groups in 50s and 60s, the cataract is very common, and if you have a gradual decrease in vision, then also you need to get yourself examined by an eye specialist. Now what exactly do we do in cataract? So what we do is basically replace your cataractus lens with an artificial lens. So this area, the cataractus lens is replaced by an artificial lens. That is the basic about the cataract surgery. That is why it is called a cataract extraction with an IOL implantation. Now what happens? Some people ask, if you do not put an intraocular lens, what will happen? If you don't put a lens inside the eye, then you will need to use very thick glasses, say around +10 to +12 diopters of glasses, so that you are able to see well. If you want a vision which is least dependent on the glasses, then we need to replace your natural lens with an artificial lens, which is called an intraocular lens. There are different types of lenses now available in the market, and that part we'll discuss later. Now, how is the cataract done is with a small incision. Small incision can be either a laser based or can be a blade based incision. You actually go for few millimeters on the side of the eye. You reach the lens and you open the front part of the lens, convert the cataract into multiple small particles, remove it with a vacuum with a pen-like instrument, and the bag which is formed, which is actually a covering of your natural lens, in that bag we inject the artificial lens. Sometimes this procedure can be a little different, but usually this is the pattern which is followed. The surgeries are nowadays, most of the surgeries are machine based, which can be laser or phacoemulsification based. And the results are generally good. Most of the times you'll have a very early recovery. Surgical time in non-complicated cataracts can vary from 2 minutes to 10 minutes, and the recovery is also very fast. Finally, the recovery also depends upon what was the condition of your cornea and the other structures, retina and optic nerve of the eye. Thank you so much.